Good afternoon, everyone. Thanks to the Summit for having me here to share my work that is outside the Canadian context. So my presentation's objective is to take you to learn more about the situations in Malaysia using the theoretical framework that is socio-ecological model to study gay men's and other MSM's sexual rights in relation to their HIV vulnerability. In this presentation, I use the term MSM more often since there seems to be more struggles for men to identify themselves as gay men in Malaysia. Before presenting the key findings, I would like to reiterate my professional and personal backgrounds. This is because I take a study approach that acknowledges the influence of researchers' own subjectivities in collecting data and drawing the meaning out of them. To a certain extent, researchers co-create findings and meanings with the subjects. Explicitly stating my positions allow you to understand where some of my analysis come from and how they are related to my position and previous experience. So these are my background. People in Malaysia told me that their country indeed not that well known to people. Many people know about Thailand, Singapore, Indonesia, Vietnam, but many actually do not know much about Malaysia. You see, Malaysia actually is among all these countries, even much bigger than some of them. Malay is the largest ethnic group in Malaysia, while Chinese is the second, then indigenous people and Indian. Islam is the state religion, and 60% of the population practice it. There are Islamic religious laws applied to Muslims in Malaysia. So this study was conducted during my school practicum with an agency called PT Foundation from February to May this year. PT was the largest and oldest community-based AIDS organization in Malaysia. It served the populations mostly affected by HIV, including MSM, sex workers, drug users, transgenders, and people living with HIV. Aligned with my passion, I conducted a study related to MSM situations in Malaysia. This presentation is based on part of the findings from the study. The study topic was devised after I had done an assessment of the agency's needs. The assessments including reviewing agency documents, meeting with the staff members, and observing frontline service delivery. The assessment showed while the agency acknowledged evidence-based practice, the staff did not have a common understanding of MSM situation in Malaysia. The staff pretty much focused on their own understanding to develop their programs. So therefore, I came up with a rather general study topic to examine risk factors for HIV infections among MSM in Malaysia so that a common understanding could be reached. So this is the method. The method contains two steps. First is to review existing local studies and program data for basic evidence. Second, to consult stakeholders for additional insights on the evidence. I also have to acknowledge that my own explorations of the gay life in Malaysia also play a part in the data collections analysis. So in Malaysia, there's a lack of study related to the local situations. Only 3 studies were known. You can see those are the acronyms of the studies. So 2 studies included a behavioral survey and a collections of blood specimen tested for HIV. The other one was mainly an online survey. They have samples from different geographical locations and sample size. So the other review is the data from the PT's testing service and outreach program. So they have different years of the data I can use. So about the consultations with the stakeholders, it was conducted through focus groups. These are the stakeholders consulted. They are included MSM program staff, volunteers, MSM in general, MSM business owners, operators, and multilateral partners. So the focus group format, I presented the preliminary analysis of existing studies and program data to the stakeholders. The stakeholders were then asked whether they have feedback on any like interpretation, associations, explanations, and additional observations. The socio-ecological model is the framework to guide my data collections and analysis. The basic idea of this model is that like there are different levels to look into factors related to a health issue, from focusing on individuals to larger forces existing in a society. So I go into the details of the levels. So what does this model mean when it is applied to MSM's HIV situations? Based on a systematic review, some guiding questions were devised to study risk factors for MSM's HIV infections at different levels. The interpersonal levels looks into MSM personal vulnerability. That could be in behavioral, emotional, physiological, and psychological aspects. And you see some examples in blue. The interpersonal level looks into MSM relationships with significant others, such as sex partners, peers, and families. The organizational level looks into responsiveness and effectiveness of organizations serving MSM. And the community level looks into cultures and norms within the gay communities. The societal level looks into forces imposed by the mainstream societies on MSM. And the supranational level looks into national, international, global phenomena. Applying this model to guide a study can help avoid blaming the victims. So there is always a tendency to examine MSM's HIV risk factors by focusing on MSMs themselves. In fact, there could be multiple factors other than individual factors affecting MSM HIV vulnerabilities. And this factor could be interacting with each other, which will be discussed later. Findings. So this diagram, you can see it shows the MSM HIV situations identified in the Malaysia's existing studies. The infection rate was found to be range from 1.5% to 5.3%, higher than the generation population's rate at 0.5%. The studies also showed an unprotected anal sex rate at around 40%. There are also like a few common reasons for MSM not to use condom. You can see like the fun factor, condom availability. And there are, in addition, some risk factors identified to be associated with unprotected anal sex. They are related to ethnicity, knowledge, age, number of sex partners, drug and alcohol use, and also sex networking environments. Applying the socio-ecological model, we can see most factors identified from the study lies in the interpersonal level. So this is the level. A couple of factors related to MSM sex partners existing in the interpersonal level, and there is an issue about condoms availability in MSM commercial sex venues. With this analysis, risk factors mostly focus on MSM themselves and their sex partners and MSM venues. So here comes the questions. So how is MSM's HIV vulnerability related to sexual rights in Malaysia? To answer these questions, I'm going to highlight how stakeholders' feedback shed light on these issues and how the socio-ecological model helps go upstream to look into structural issues. So to respond to these topics, one example is to look into the risk factors related to ethnicity. The study review and programs data consistently show that Malay MSM has a higher infection rate and unprotected anal sex rate than Chinese MSM. You can see the blue and the contrast with the figures on the Chinese MSM. So what factors might be contributing to Malay MSM's HIV vulnerability? Not a surprise, the stakeholders from the consultation associated this vulnerability with Islamic religious belief. For Muslims in general, their belief in fatalism might make Malay MSM perceive less control over their life, including HIV prevention. Also, condom use is forbidden in their religious belief. In relation to MSM, Islam recognizes heterosexual relationships and behaviors as a norm, and homosexuality as a sin. So there's no support and acknowledgement to MSM's sexuality, which could possibly lead MSM to involve more in risky behaviors because of stress. So indeed, these beliefs are transformed into structural barriers or actions that put MSM in a more non-supportive and stressful situations. During the stakeholders' consultations, there were discussions about comparison of the situation between Chinese and Malay MSM. For Chinese MSM in Malaysia, they received more public acknowledgement of their sexuality, like that Chinese media have more coverage about homosexuality than Malay media. Chinese MSM can also look for recognitions of their sexual identity from overseas Chinese media, like those in Hong Kong and Taiwan, where have more films about gay men and more actors are known to be known as gay men. However, there is a stricter censorship on representations of MSM in Malay media. During the study period, a gay film called Dalam Botol, meaning trapped in a bottle, was in theater. However, this film was criticized for perpetuating misconceptions about gay men. That is, the gay male character undergoes a sex change for the sake of establishing a heterosexual relationship with his lover, which conveys heteronormativities. The character eventually regrets the sex change and ends in a depressing situation. In Malaysia, there's a film censorship guideline that is about whenever there's gay character depicted in films, they have to be repeat their homosexuality. And another incident is that Malay MSM public representations was being scrutinized. This one, the YouTube video of a Malay Muslim gay man for the It Gets Better campaign in Malaysia was removed because he was threatened by a religious authority that he would be prosecuted under the religious law. And also in education, there was a case that in a Malay-dominated state, schoolboys who were identified as displaying feminine qualities were sent to an education camp for correction. In this quote from the State Education Department's director, the camp was claimed to guide the students to a proper path in life. So, applying the socio-ecological model, you can see there are more structural issues existing in the organizational and societal levels. Different institutions control discussions, representations, and expressions of MSM sexuality. The causes underlying all these actions are the Islamic beliefs and the dominant discourse of heteronormativities. As a result, MSM sexual rights in expressing their sexuality are being suppressed. How are sexual rights related to MSM HIV vulnerability? What I'm going to show you is that how the socio-ecological models looks into the interacting determinants of health. Okay. So this one looks complicated, but I'm not going into details. So I did a mind map. So basically what I did is I added more risk risk factors, right, from the discussions of stakeholders consultation. And also I try to link with the relationship between different factors. So what I want to highlight is about the Malay situations. So here's the box about Malay's HIV vulnerability, pretty much about their behavioral risk and personal psychological state at the interpersonal level. So I use different colors to indicate different levels. So however, when you go deeper, you can tease out there are some structural factors underlying, such as negative public discussions and representations of homosexuality in different institutions. Going even further, the risk is originated from the religious belief and the discourses of heterosexism. The implication is that while focusing on MSM interpersonal risk factors, we need to reflect on how much work we have done on the underlying core issues that affect MSM's HIV vulnerability. So what to do in relation to these structural barriers? Under the context of Malaysia, it's hard to challenge the core religious belief in relation to homosexuality. So a rather creative approach in health promotion is required to avoid direct confrontations with religious belief. Here is an example. In response to the education camp that I mentioned, the Women, Family and Community Development Ministry asserts the camp violates the right of children who are to be protected of their mental health, regardless of their background and status of any kind. So in her stance, she talks about race, sex, or other different status. So this example shows that how a stance in advocating basic human rights that relates to one's health without directly challenging religious belief about homosexuality. So this is the conclusion. So while looking into MSM's HIV situations, we need to examine HIV risk factors beyond the interpersonal level, target core issues that underlie personal vulnerability, where a rights-based lens to address rights related to MSM's health, apply the socio-ecological model for comprehensive understanding of health determinants. So here are some acknowledgements. So this is the end of my presentation. Thank you.